Hello, everyone. All right. So we are down to the last session. I think, wow, what a day, huh? I learned so much from all these talks. I hope you guys are too. But from popular request, a lot of people complained that I didn't give you guys the floor to ask question. I guess because, I'm too excited. So I asked them the question. So for this session, we're going to change around a little bit. So I will ask 1 or 2 questions and then open up the floor to the audience. So please prepare the toughest question of the day for our panelists, okay? So, think about the question. Let me start out with so I'll have 2 questions. So the first one is, how close are we to see the real world adoption of all these, AI in medical, in healthcare? Like people actually using the products and, relying on the diagnosis and all that. And, feel free to jump in, no order. So.
I suppose I could start. I feel a little bit off because it takes many years to make the drugs. But then there are many layers to the question, because first of all, actually people already trust the automated system. Like everyone getting sick, go to Google and search for symptom and answer. And actually you trust it more than the GP. This is one layer. Another layer is that within the hospital itself, many form of intelligence assistant are already there, right? So even in Vietnam itself, people already have the telemedicine that you can send an image to Zalo and the doctor actually can have the diagnosis. So it's already there. The question is that whether people trust the AI suggestion. So there are 2 things. One is that, actually 3 things. One is that the diagnosis is, what are the problems, or what is the disease? Then I think the accuracy of certain visual domain are quite good right now. Not all are good, but some are quite good. So those could be trusted. The other part is that the prognosis, which is predicting in the futures, right? What for me if I have cancer, right? When I'm going to die, right? or if at all, right? So it itself, to believe me, I work with oncologists, with the doctors for cancers. They have no clue. And if they blame AI, you should blame the oncologists because they don't have a clue, right? So the diagnosis is quite accurate and doctors are very good, but prediction in the futures, no one knows, right? And that actually is one of the areas that AI can assist even more. But then, of course, the level of trust vary between countries, and the problem and probably Dr. Hung here can have more accurate answer.
So I think in my point of view, everything starts with quality. So if you have a good quality, then you will earn the trust. So trust is earning, not by giving. So in the context of AI for medicine and AI for healthcare, I think is also have to start with quality of how you produce, the prediction and using AI. And the second of that is also, like some of the trick that you can do is by having interpreted an indication. Say, for example, when you do the detection or diagnostic, you need to show the doctor that how your model come up with, so that you can earn their trust. The second thing is you need to be in the ecosystem, working closer with them, and to really, showing the progress and making the difference. And then the third is you have to understand that the challenges ahead. And it is a journey. It's not just one time you can get it done. So you need to have a good feedback loop, not only from the doctor, but also from the patient. So those are critical areas. In my observation, I think like in Vietnam, the doctor in Vietnam seem to be more open than the doctor in the US. And why I'm saying that, because I believe that the doctor in US, especially in America, it is a long journey of investment. So they got a lot of training, a lot of things. So their expertise is deeper. That's just like in the reality. So when they have a lot of investment into it, they believe in themselves. And that is human nature. So I think that probably the problem starting to solve and get adoption in a country like Vietnam first, and then you can eventually roll into USA. Thank you.
Yeah, please.
Sorry. Actually, I totally agree with Dr. Huyền Trần, and because we work in university, so we try to help the doctor and the nurse reduce time for the patient. So that's the reason why we apply the image from the hospital, the real image, and try to reduce time for detect, for example, cancer or tumor, something like that. Actually, we need many steps in the future, right? Like the doctor can, know about the diseases or something, the cancer, right? But I think in future we can guess it. In our research field, actually we are newcomer with the AI. We just try to step in the AI, apply in our university. That's the reason why just very the new results, achievement for in our labs.
Yeah, very interesting. So one thing about AI in healthcare is that the consequence of the wrong decision, right, wrong diagnosis, is very high. So how do you guys mitigate the risk, versus the usability, right? If you are too cautious, then then it's not really useful. And so how do you kind of balance out these things?
I can start first. So basically, the fundamental of how we mitigate the risk is, in medicine and, basically in general, is a lot of responsibility because we deal with humans. So the fundamental of this is, first, you need to start with the scenario and be realistic in the sense of, say, AI will be assistant. AI will helping, the expert to do more efficient, to do better consistency and accuracy, and also solving the problem of bias. That like patient choose the hospital, not the hospital choose the patient. So what I mean by that is each of the hospital, they have expertise of certain field, and the patient will tend to go to those hospital. Giving a sample, like say John Hopkins, they have more patients about pancreatic cancer. But if you take that problem and go to UCLA hospital, you have only few cases of pancreatic cancer there. So this is a fundamental piece, and I think that AI can help. And I think I refer to the first question from Dr. Thuc mentioned that, what do you feel about the readiness of AI for medicine? I feel personally, AI for medicine today is just like 10 years ago when people were talking about self-driving car. So it is a long journey, but it is the progression will go there. And I believe that someday AI can help in the medicine.
Great, thank you.
Maybe I can play the role of a moderator,
yes.
because
Yeah,
I'm not an expert in healthcare. But I think a lot of the companies and experts are actually companies, they're focusing on empowering doctors. What do you think about empowering patients? Helping patients to understand their medical record better, or could be any other things.
I think it's a really great point because actually the medicine so far has been asymmetric in the power. In the sense the doctor have absolute power and patient have almost none. because you have no power. You're dying, right? But you're right. So humans actually have better rights to understand their condition better, and actually they're helping themselves and doctor better. So I can give you my personal case. One of my relatives, young one, have certain mental issues. And because I work on suicide prediction before, so I actually use my own model to fit his data into my model, and it was quite high risk. So I told his parents that watch out in the next 12 months, because bad thing may happen given the models is, well, you train on 10,000 patients, it wasn't much, but enough for me to raise the point to the parents. The parents didn't listen because they trusted their son, right? They trust the son to the parents, a very lovely son, without any trouble at all. But I'm an outsider, right? I got observed and saying, look, it have all the signal that I've been detecting from my own model, and you better watch out. And I was, unfortunately correct. So about 10 months later, the boy took a lot of overdose. He was lucky to get through it, but it happened, right? So I'm not no doctors. I didn't alert the doctors because no one believed me. Doctor didn't believe me either. Because in mental health, no one have any idea how things works. Because the only thing they take mental health that they ask the patients, and the patient under mental health condition, they have no idea what they're doing, and they lie all the time, right? So there's no way you can detect mental problems when it comes. Right, so actually, machine is much less bio in that sense because it collects a lot of signals. And I say eating disorders, or sleepless, or shouting, or many other behaviors that doctor didn't care, because doctor have 1 minute in front of patient asking, "How are you?" and the patient said, "I'm fine," and just go home. And the doctor said, "Oh, this guy is very hard to deal with," and that's it. Right? So actually, helping patient actually have more power than helping doctor, because you're right, doctors are so absolutely conservative and over proud of themselves. They never believe you, right? But certain doctors do, like doctor with mental health and doctor with genomics, because those areas are very, very underdeveloped. Right? Genomics right now, biologists know better than doctors. In mental health, the same thing. Right? There's no way you can understand human mind, not human brain. You can understand human brain, but not human mind. There's no chance, right? So there's two areas I found that helping doctor and also helping patients are very empowering.
That's a fascinating story. Thank you for sharing with us. Okay, so last question from me. How far can we push this? AI in healthcare, is the sky the limit? Or you think that there's a barrier that, humans will always be there and, play an important, significant role?
I can answer a bit because actually healthcare has a word care in the name. It means that human care for humans. Right? You never replace doctors, because what we need is actually an extra human to advise you and look after you. Right? AI can reduce error, can improve the accuracies, can predict better, but at the end of the day, it's still the human in the process. So that's my predictions.
Yeah, I agree with Dr. Truong. I think that in the problem that like Wing Brain, my company try to solve is we don't think that we can like get into the expertise level like radiologists that been years in this field. Their knowledge, their experience is far exceed. However, we can achieve by, like for the young doctor, the doctor that never familiar with radiology, imaging, those things, we can have AI to help. So that's why the problem of Wing Brain is try to tackle it from the fundamental, which is we starting from the easiest, like imaging, which is X-ray. And the second is X-ray is popular in any, like clinic and small, like, like hospital or even in the rural area. We have more X-ray machine than CT machine and MRI. So for successful AI for, diagnostic, we need user. And the user in here is not the radiologist with a lot of experience, but also with the doctor, with the general doctor that can use it to help the patient to route it to the right specialist, to identify if it no DC, they can go home and have a drink and then have a coffee, but it's important is the accuracy, the quality I mentioned earlier, and also the usage of that with the feedback loop. I mean, like AI is not like just one time you're creating the model and then you say you're done. No, it is a journey. And I'm giving a sample today. Wing Brain, we committed, try to get like 1 million label data. We're not talking about 1,000 because deep learning, it's very hard to talk about like, oh, you have only few thousand and you say you achieve it. Look at self-driving car, how much data that Tesla have. So just be realistic and like solving the problem deep enough and really persist on it and focusing on it. Otherwise, the doctor will shy away and say, no, your AI is just a toy. That's what I heard from the doctor in US. Thank you.
Okay, I have one story about my student. He had a just small project. He tried to make some the question, and the patient, because the hospital overload for the patient every day, every month, and then he just write some question, ask about the normal days, you eat something, and about the health, and then finally he get the one result. The result can conclude that you need to go to the hospital or just stay home and take a rest, something like that. So you can see the AI can help the doctors, can reduce the, overload, right? Just one story about my student.
So for me, one possible scenario that I imagine in the future, you can have your phone as your personal assistant. So I think people have developed techniques that you can use your phone, right, to take picture of your skin, and it can sort of detect, if you have skin cancer. And I think I really believe that, nowadays there's research about you can look at the eye's image. You can detect not only the eye disease, but you can also tell about your heart disease because there's a blood vessel in the eye image. So these are quite powerful, and I imagine a future when you can just take your phone, talk to itself, it listen to your voice, how you saying things, your skin color, your eye, then it can tell, hey, you might have a problem, maybe in a few days or in a few weeks.
Yeah, and then with the introduction of wearable, right? So now, these wearable devices collecting so much data about a person, right? So I think that's a lot of interesting thing that we can do there.
Yeah. And I think one more I want to add is, I think like to solving the AI for medicine, I think that it is a combination of software and hardware and IoT and AI. And I think that's one of the mission and the objective that we do in Big Brain, that we also working with, university in US. For example, like we also working with someone to research on how we collect the brain signal, the breath, the heartbeat, and combination of that, with the imaging, so that we can make a better accuracy, precision and prediction. So it is, like I say, it's a journey, but we have to start something. And if we believe in it and we continue to work hard on it and we have a great team, we can do it. Thank you.
Great. All right. So that's a nice ending to the question from me. Let's open the floor to the audience. Please raise your hand if you have a question. Yeah. Can the team give the mic to... Oh.
Okay, so I have a question for Mr. Hung. So in your presentation, I see that you say in the US right now, FDA has no kind of formal process to approve AI for medicine. But I also know that in the US right now there's several AI products like IDX-DR for diabetic retinopathy, and also GE just released a product for X-ray, chest X-ray analysis using AI. Also, it's FDA approved. So is that so those two cases, are they just exceptional, and still FDA has no formal process to approve AI-based product, or what?
So for my knowledge, talking with, like top few university in radiology and also in the AI field, like for example, like Harvard, Dr. UCLA, and Stanford, and things like John Hopkins. So what I learned is basically so far the AI that they got approval is more like a kind of a part put into the medical devices so that they can improving like, detection or maybe the accuracy of how to make the image, evaluate or capture correctly. But it's not from the kind of like the end of detection or the end of classification. Like, you can say, okay, let's give the AI to do just like a radiologist. And I haven't seen that. I could be wrong, but I think like so far from the latest news, I haven't seen that. I see that AI can apply in one of the states. Like maybe, okay, the machine is, should be optimized to be at that angle for this kind of patient to make sure it's more accurate in terms of getting the imaging and things like that. Or optimize it to get the higher, like, the light and, the dimension that you can take. Or recommend it, like maybe you can take like more CT scan, slide versus than less, so those things. And I think that the other challenges that in radiology is also like each of the company making the machine, which is like say GE or Siemens or Canon or something, they actually are doing their kind of like way of optimization, just like the compiler, like the C++ compiler. Many providers are doing differently. So the standard is not there yet. And I think that the FDA even like try to say that, okay, they need to have a test set to really do the end analysis, the end conclusion for diagnostic. And today the definition of a test set that they have is, do you have American people in the training data? And training data in here is, they must have like black people. They must have like, the Indian from like America. So like say for example, this is a company doing very well in the mammogram diagnostic in UK, and they tested with the 4 country in European. But when they tried to bring that product into US, they couldn't get into it because their training set doesn't have American in there, for example. Thank you.
Great. Next question.
Hi. So I'm Hung Ngo. I'm the founding director of the Center of Talent in AI, or COTAI for short. I would like to ask Tran about his work, but I invite you all to have a take on it. So, in your talk, we see that we try to kind of represent the drug and the molecular in terms of like vectors, and then we apply the conventional deep learning framework to do the predictions. Even though we can use like graph convolutional neural network on that, but for me, since the search space is huge and is I don't think the conventional methods would scale well. Yeah. So I think it's better we exploit the inductive bias in terms of the chemical properties of the things, right? If we add this and that, it's gonna react like this, and we're gonna end up with that with such properties. So my question is there any way we can exploit such kind of prior knowledge in terms of symbolic level, right? To incorporate that into the sub-symbolic level of the deep neural networks, so that we can have better generalization beyond the smoothness of the embedding, like for something like combinatoric generalization, right? Go beyond whatever we use to train, and try to combine the known blocks to invent new things. Yeah, basically. Yeah. So, do you know any existing work, or do you think it's necessary to go in that direction, like something like combining symbolic reasoning and deep learning? Let's call it deep symbolic or neurologic methods. Thank you.
It's a very, very difficult question. It's a very, very, very complex one as well. But I could say yes for whether we need domain knowledge into the models. Absolutely yes, because the search space is so huge and data limited, right? So it can't generalize beyond the training data very much if you don't have very good physics introduced in the system, right? So a lot of rules in chemistry is being found, a lot of rules in drug design being found, a lot of human knowledge is being formed. So there's no reason we should not use those knowledge, right? So the answer is yes, absolutely. And the next question is how. We don't have very good clue right now, but there has been some work. One is that I've seen the work last year, so they call Gamma VAE, in the sense that they use something like 20 chemical rules, so that they for any molecules, you can pass the molecule into the set of rules, known rules, so that instead of operating on the molecular space, you can operating on the rule space. So that you can combine those rules to generate beyond the data. So the result was very good. It reduced the training size and improved accuracies. Another work I mentioned was reinforcement learning. So actually, it's not blind reinforcement. They use the known knowledge of substructure of the compound, that certain chemical groups that tend to work together and tend to bind together, so that they actually design the explorations based on the chemical knowledge. There's no blind exploration because it's too hard. So people, I think, very aware of that. The one that I mentioned was using vector was a very early one, and probably now no one uses it anymore. But it was a first proof that we actually can compress the discrete combinatorial space into continuous and explore from there. So it's more like motivation rather than the realities as people are doing today. So yeah, I think yes, and there's some hope already. Yeah. And to answer a question about symbolics, I don't have much clue, but in terms of the chemical planning, so they actually use symbolics rules to plan for what kind of reaction to come to that point. Logics, I don't know much because probably it's a little bit too early to apply like first order logics, for example.
All right, great. Next question. Oh, okay. I think the lady has the mic first, so okay, please go ahead, and then we'll have you ask the question. The gentleman ask the question after. Okay, please. Okay, while waiting, maybe.
Okay.
Oh, yeah, never mind. Yeah, please go ahead.
Thank you. Hello, everyone. I'm Ngung, and I have a question, specialized for the panel discussion. Thank you for your global and international mindset about the artificial intelligence. However, as you know, in Vietnamese circumstances, how can we apply the AI for the healthcare, for example? Yes, in Vietnamese cases. And as you know, in Vietnamese hospital, we have to make a line in the public health service. Yes, I mean the population of Vietnamese. So the question is, how can we localize? In other words, how can we customize the artificial intelligence, not in American circumstances, but in Vietnamese circumstances? And this is a question specialized for Mr.Hung Uncle, CEO from Vin AI.
Thank you for, it's a good question. So I think that, let me rephrase the question. So the question is about how can we apply AI to solve for the Vietnamese and how we can make sure that that specification or specialized will be so kind of like with a good quality. And correct me if I'm wrong, but I think that is the question about. So I think when you do AI and especially in deep learning, you always have to start with the labeling data set. So you have to basically in Vietnam, you need to collect the data from like the north, the middle, the south, and different hospital and different DC that you try to classify or detect or segmentation. And then you will use that as the kind of like, high quality with labeling. You can apply, if you don't have enough data, then you can apply like, transfer learning and other technique, including like auto augmentation, auto labeling, and you also train the model that, maybe into the two layer. One is more generalization for different, people of the world, and then you also have another layer to maximize and optimize for different region. So that is a thing that you can do. The other thing you can do is if you feel that is taking so long to get the result, especially like like ensemble model is huge and take a lot of like CPU, GPU, and on of the training, then you may probably try to like optimize it by do a pre-train and then also do a like different like segmentation for the data. I think like today in the medical field, they have a concept called 4P. So the P is stand for like, personalization, prediction, prevention, and participatory. So I think like it's already tackled and tried to optimize in the scenario that you described. So I think like in machine learning, if you cannot achieve that, sometimes you can apply like, the concept of rule-based and then making that apply for your own. But like say that you have to collect the data and you have to collect, enough data to train and optimize. And then you're also using IoT and other kind of technology to continue to monitor and collect the data and then using the concept of like, E&E, explore and exploit, and then also like active learning, reinforced learning. But like I said, that before you actually doing reinforced learning, you probably need to have a bootstrap so that you can have enough, quality. Then you can apply the reinforced learning, But I think technology is moving, allow you to have more supervised and all of the other technique that people talking throughout today. So it is a journey that you can bring things together. But at the end of the day, I feel like just like you're teaching a kid before, they can run, they have to know how to walk first. So walking is where you need some kind of a labeling data supervised. Then people can start running because you can see the kid, you never teach them to run, but they know how to run because they learn how to observe and then improve themselves. So thank you.
Yeah, all right, thank you. And Hung. Okay, last question from the gentleman.
I have a first question for the two speakers that intend to use AI to diagnose the disease. One using radiology and another using these pictures you collect from the general data sets in the internet. So we know that is to subscribe research costs a lot of money and a lot of time and a lot of effort. Like Western Health is invested in about more than 100 millions to billions USD, and every year so they have to load into the inference system more than 1 million of medical research inside that. But the result they get is quite limited. Even they also get some breakthrough very well, like in the rare cancer diagnosis. And you think that you create the wheel again, or you intend to compete with Western Health, or why don't you focus into one disease and do it best, rather than to do in like a zero diagnosis of the disease? The second question is for Dr. Truyen. So do you have any example about the drug or medicine commercialized already, but using AI to build that medicine? And what I have seen in your speech, you also give us the descriptive model of to build the drug. But do you have any predictive model so that you can predict how the people use the drug designed by AI or not?
Okay, let's keep it brief. Maybe Hung can take the first question, and then Truyen can take the second one.
So I'll start with try to answer the first question is, should we focusing on only one or two diseases rather than generalize so multiple disease for radiology diagnostic using AI? So I think that in my opinion, yes, I think you're right that is when you creating an AI product, it is an iterative process. So fundamentally, you will be basically focusing on, you have to develop the metric to measure the quality first. And then that's one of the fundamental when you creating and measure the quality of the product. During that journey, you try to collect as much labeling data and also go by the geography that you can collect to ensure that you have the clean data. You can think that clean data is more like gasoline versus than the other, just like raw oil. Some of the oil, today is not economy to suck it up. So I think that you have to look at the whole thing when you evaluate from offline and online. And maybe, yes, you may not have to do, like say, on the 18 DC that today Wingbrain try to do, but maybe we can tackle, like maybe the beginning we do 6, and then we do another 12, and then another 18. I think like also like you look at the problem from the complexity of the imaging you're going to take. Say like for example, X-ray you have only a couple of image, but like for CT scan you may have like say like Wingmax system today they have the most complex expensive machine like it have like 640 image per CT like cases. So those things you may tackle is in the next day. So fundamentally, I think I want to share when you build a great product or a great AI, you start process it from vertical. You start from the scenario and get it into the quality, rather you go broad. So I think I agree in the principle that we don't want to tackle and boiling the ocean of the world. I think a lot of it is just like a PR. The reality when you create a product, you need to differentiate and make it uniqueness. So those are very fundamental. We're not here to do PR. We're here to create something that create impactful. So I think the philosophy of make sure high quality, measure it, make sure we continue to measure and evaluate it. So thank you.
Yeah, thank you. No, maybe keep it brief.
I believe that. Oh. Hello. All right. I think is the question. Your question have two parts, right? I missed the second part, so probably I have to ask you again. But the first part is that is there any drugs being generated, like designed by AI, right? The absolute answer is no, right? Because the drug is a complex process. So AI would be part of the entire process, mostly through screening, suggesting predicting properties, and suggesting the type of compound that is most possible, and probably involved in optimizing the drug itself, but the actual making the products made by chemists and testing in the lab tables by the chemist. So whether or not we could say AI make it, no, we couldn't. But AI already being involved in a lot of processes, sub-processes within the entire discovery pipeline, and the rest, like after you have the drugs that you're happy with, the testing on the animals and trial on humans or apes are taking many years. So if you ask whether any drug being designed by AI, absolutely no. The example I saw was one of the latest example, like 2 months ago, that the AI can suggest a drug, not design, suggest a drug within 46 days, and it was being tested on the mice with the positive results. And we stopped with the mice. Did nothing to do with human yet, because it takes many years for approval. But I would say that AI is already within, like being used within like many sub processes in the discovery pipeline. Right? The interesting part is that where this thing would happen faster, the answer would be China. Quite interesting because the legal barrier is lower to try things out and testing out. Approval may be also faster. Of course, FDA is a long process, but the research itself could be sped up a lot in China. So the second part of the question involving prediction, sorry, I missed that. What was the question again, please?
So you also have sold to us the descriptive model to build to design a drug, but do you have any like a predictive model to that the effect of the use of the drug designed by AI or built by AI or not?
So the question was whether you have any prediction model.
Predictive model.
Of what? Sorry.
To predict
you predict the effect of the drugs?
The effect.
Predicting
on the
effect.
patient.
So they, the model itself is not difficult to build. The more it's about data. Like the more important thing is about clean data. So the model itself is not difficult to build because when you have data, we can build model to train it and it can predict just like other imaging system. So whether we do have that, yes, we do have that. But the data quality would decide everything.
All right, great. I think that concludes our session. Thank you to the panel. Please join me giving a round of applause for our panelists here. And
So I have one save the last for the best, right? So my company create have a T-shirt. So this T-shirt is a few people. We just do a test right now, but few people from Big Brain sit on that side can hang over. We have a limited set because we just do a test. But this is have the logo like anyone, and then in the back it have like the base rule. So we try to
awesome.
be creative in AI. And second, I think that Big Brain very fortunate to partner with
Thank you.
big AI. So I think I want to say that leave the best for the last people that attending this section.
It's
so
a very
you can
nice
pick
t-shirt,
up
so-
some T-shirt from from people from my team. So this is a base law that you can see more detail, but we don't have time to explain. Okay. So
all right,
thanks.
thank you. Thank you for your generous offer.
Thank you very much. I would
please
like to
welcome
give
in,
you